Good morning and welcome back to my episode. Yulli here. Happy February. February is such a special month for me, like every other month, but February is about love, self-healing. Very important month just to fall in love even deeper with yourself. So I'm very excited about this episode. And today I have a guest in my podcast, which I'm very excited. Dr. Avila is here with me. Good morning, Dr. Avila.
Good morning, Julie. Thank you so much for having me today.
Nice. So a little bit of background. So let's tell our clients, our audience, how we met. Like, oh my God, it's been so long.
It's been a long time. Yes,
Yeah.
I want to say since 2001, back in high school.
Oh my gosh, yes. I moved to this country in 1999. So yeah, we met in high school, and Arturo and I were taking ESL classes. And it's just incredible how you never know where this journey is going to take you. Like, I would have never thought, like, 20 years plus later, we're healing hearts, we're healing people, and it has been such a beautiful, because I always, when I think of you and your family, you guys are my family, you know. It's like such a deep, beautiful relationship since it's basically we were kids, you know. And one day, remember when I found you at the physical therapist and I was doing massages. So you've been sending me clients since 2008. I still have clients coming here from 2008 from Nova. So what a blessing. Really, you have no idea. You helping my clients tremendously, and partnered up here has been very, very beautiful, because the difference that we're making in people's life has been incredible. Yeah.
I agree. And definitely, you're super special to me and my family. And I truly, again, appreciate you inviting me to your podcast. And truly has been such a journey for both of us, right? I remember coming across at some, having conversations about our future careers and coming, crossing paths and catching up and just look at us where we are. So very proud about us and proud about help, being healers to help people around us and help them improve their quality.
Absolutely. Absolutely. I always like this healing center is so special to me and my team. And I always feel like I know we can help people even deeper than this, because as a therapist, massage therapist, myofascial release, everything we do here, I know what was missing was the structure part. And I think you are like the piece of the missing puzzle. Like, you are the one who, like, yeah, now when I see a client and I just already see, oh, my plantar fasciitis, my IT vein is bugging me. Like, I can just see the structure of their hips. I'm like, you need to see Dr. Avila. He's really gonna take it to the next level, because our goal here for our clients is to eventually get into the area where maintenance, and that's why you come. So tell me how you decided to become a physical therapist. What drove you there?
Very good question. I actually started back in high school. I was very fortunate to have graduated from West Potomac High School, where I did a year of physical therapy and occupational therapy schooling there. And so that drew me into the field. I went on and got my associate's degree as a physical therapist assistant, and then got my doctorate degree in physical therapy from Shenandoah University. And it's been almost 20 years since I've been and practice. And I will have to say, having worked with you and with your team has been such an enlightening experience, since I can truly appreciate the holistic approach, right? We talk about this working with other disciplines and in so many levels, but to have worked with athletic trainers, massage therapists, and now myself as a physical therapist, it's truly can appreciate the impact that we make in people's lives, and that has been such a wonderful learning experience, and I definitely appreciate you for welcoming into the team and being part of this amazing experience, not only for us but for every client that we treat.
Yeah, no, honestly, and the difference that we're making into people, that's, to me, that's just priceless. People like with chronic pain, that you get them better, with the combination of your work and the combination of the sport massage or myofascial release. This is really a hidden gem here in McLean. Like, it really, really, you feel the love, you feel the compassion, you feel like when you walk in here, you're gonna get something out of it, and you're going to start healing. This is your healing journey. So make it February your healing journey. So let's dive into finding the root of the problem for the patients, because sometimes, like you always say, we cannot treat the symptoms, but let's find the root of the problem. And I love that, because that's how I describe to people when they want to come to you. Arturo finds the root of the problem. With the massage, you're going to feel good for the moment, for the day, for a week maybe, but we're not fixing the root of the problem, So let's dive a little bit into the root of the problem here. So I have a couple of questions here for you. Why do so many people struggle with chronic pain even after trying multiple treatments?
I think it goes back to what you said earlier. That is really, really important to finding the root, right? I think and this is my always, when I first encounter a patient or a client, my focus is to, after having completed the evaluation and the examination, is to figure out what my top diagnoses are. So I have to come up with a list of what I think is wrong with the patient or the client, and based on that, it's going to delineate what the treatment plan should look like. And if I'm struggling down the road and trying to locate and trying to get an improvement, desired outcomes, based on what my interventions have been, I will then go back and reassess and look at my previous hypothesis, and then I can derive from there. So it's really, really important. I always say 50% of the battle with every client is to find the root cause of the problem. Because that, once you know what's wrong, you're going to already be on the road to recovery, because you'll know what to do.
Exactly.
Right.
Yeah, and that's why it's so important here in the Healing Center that we customize every treatment that depends on what they feel, what their problem is, So there is not just a treatment for everybody. We have people with scoliosis, plantar fasciitis, hip disalignments, ITV, and all this kind of issue. And that's why you really focus on the finding of that, and I think that's where the root of the problem comes in, and it's easier for you to treat the symptoms.
And it's also important to consider that the root of the problem might just not be located in one body part. It could also be affecting multiple body parts. So it's also important to keep that in mind.
Yeah, that totally makes sense, because sometimes people will come with, like, for example, lower back pain, and I work in the abductors and the inner thighs and the ITV, and the pain releases, and they're like, you haven't even touched my back, and I feel so much better. Yeah, that's absolutely right. Yeah. Let me go to another question for you here to dive into the root of the problem. How does neuromuscular therapy helps identify the real source of pain?
So with neuromuscular and physical therapy, what we're doing is we're trying to pick up all the signs and symptoms, right? You have a case, you go through the examination, you go through the evaluation, you make a list of all the impairments, all the issues that the patients are or clients are complaining about, what they might be pointing to a distal area from an area apart from the source of the pain. You pick up on all these elements and you put them all together. And as you're going through the evaluation, you're going to find out areas that are inflamed, areas that are restricted, right? You address that with the goal of fixing the problem, with the goal of improving their symptoms. And it's also important to keep in mind that you as a outstanding massage therapist and I as a physical therapist, to keep in mind that we cannot fix all of the problems, right? We might not be able to fix all the problems, but also to keep in mind that is something that I see being done at our center is that we are referring clients outside of our scope of practice, right, or our scope of work. So it's also important to always keep that in the back of your head that we have to be aware for the safety and for the well-being of our clients.
Absolutely. And that's one thing I hear it often here at the Healing Center, like Dr. Avila, actually, they just don't come for a treatment here, but you educate and you listen to them. And there is, for me, it happens that there is times when we can't help the client, so we have to send them somewhere else, to maybe a chiropractor or maybe with the pelvic floor, different physical therapists for them to help them. And that's the uniqueness. Like here, we care about the client so much that we want them to heal. We want them to get better, Yeah.
One of the luxury that I feel we have is the time. I think we truly invested time in every client, so we're able to pick up on all their symptoms, all their complaints. As a result, we're able to provide better guidance. And the network that you and I have, it's incredible. We can, refer people to professionals that we truly know can provide excellent care. So I think that's definitely one of the advantages we have.
Yeah, and that's what I love you coming on board at the Healing Center, because when I tell client, like, Dr. Avila can definitely help you with this problem. They're like, oh, is he gonna make me do a bunch of exercise? I say, no, it's manual therapy. So he actually works on you the entire hour, and he might see a problem with your neck, with your hip. He's not only gonna focus on your neck, he's gonna focus on your entire body. So explain to people what is really manual therapy and what is the difference between spending the 60 minutes in the manual therapy versus when you go to a center and they spend like 10 minutes, 20 minutes.
See, one of the differences about what makes us different from other centers, other practices, is it's again having the value of time, right? So not only do I have the time, right, to listen, to pick up on all those signs and symptoms, but and not doesn't only also consist of manual work, right? We know that there's a lot of studies supporting the use of a multimodal approach, whether it's a modality, whether it's going to be therapeutic exercise, therapeutic activity, looking at their biomechanics, looking at their positions, right? All this education on top of the manual therapy, right? That is what makes us different, because we're not only able to just look at what the knee is doing, right? We can look at the ankle and see how that's interacting with the knee. How is the toe interacting with the ankle and affecting the knee or the hip and the SI joint and the back? So you're really just having that quality of time, that time to just consider all the body parts and how it's functioning globally, as you're stepping forward, as you're going up, is getting up from the bed, getting up from the chair. It truly is a very comprehensive approach, and I think that, truly believe that that is what it's a game changer for our clients, not only living in chronic but also acute pain.
Yeah, that is so interesting you're bringing up about time, because when I created my healing center, I wanted to be more obviously focused on the patient, but also the therapist. Like, if you're coming from 90 minutes massage, you're gonna get 90 minutes massage in here. And we also, between clients, we put 30 minutes in between, because we might speak with the client, educate it, and this is a place, especially when we have new clients and they're rushing to get here and in the traffic, and I just like, take a deep breath, slow down. Like, this is a place to literally slow down. That's why Dr. Avila takes an hour for physical therapy, something that you don't see out there, because you go to a center, a PT, and they give you the 10 minutes plus the exercise, and then go home. And then here is, we really focus. That time is for you. And when I start my massages, I tell people, this whole hour or 90 minutes or 2 hours that you have with me, this is your time to yourself to decompress. Give that permission to yourself to just let it go, release everything, and just enjoy it. So no time here, and that's why this is place literally to slow down. The water is going so fast out there that we don't need no more 100 miles per hour. This is a healing center that comes, and it's good for your nervous system to just slow down, take a deep breath.
And I agree with that. I think a lot of our clients and patients can speak to that. As soon as you walk into our doors, you can just feel just the peace and the peace and just how comfortable it is to just be around, the people that we work with, the environment that we provide, the comfort that we provide, and the time, and again, more importantly, the results, and that is just priceless, like you said earlier.
Yeah, no, it's a beautiful thing, and like I say, we already going 100 miles per hour outside, so this is a safe place to heal from the inside out. So why is fascia, and why is so important in healing?
I think fascia, as many people don't know really the effects of it. We know it's a very important structure, just like muscles, just like joints, bones, and how the whole system interacts, right? Oftentimes we've seen many clients in chronic pain whose fascia has never been addressed. I think it's a structure that doesn't often get addressed in healthcare, and it's also important to consider, and based on the training that I have had over the last almost 20 years, is that you start, in school you start learning, or early in your career you start learning just, okay, joints are important, let's address the joints, or the importance of muscles, muscle care, right? But fascia is not one structure that people just overlook, and its importance is tremendous, especially when you have someone who has diffuse unexplained pain, right? And I think that's just one of those hidden structures that can really be provocative to a lot of our clients, a lot of our patients. And I think it truly is it's the care that's needed to it's important, and an important structure to be addressing.
Yeah, I think this is amazing, because you take care the physical part, and we as massage therapists, we also take care of the myofascia, the fascia, who's covered the entire body, the entire muscle, because my theory is that when people especially goes to trauma, it does surgery or something personal, it gets stuck in your fascia, and that's the emotional part comes, right? And that's why I do sound healing. I do just to trying to calm down the nervous system, all the emotional part, and then you take care of the physical part, so it goes hand on hand, and people are like, oh my gosh, it's like literally like healing your inner, and then you heal the physical. It's great combination,
And I agree. I think the collaboration that we have here, it's very valuable to our clients, because you guys can focus on a certain aspect of that injury, that body injury, right? And all of us, just with our different backgrounds and training, can really make an impact in everyone.
Absolutely, yeah. The collaboration that we do, the both of our brain is, I'm telling you, is such a blessing. Is to see the results of that in our clients is totally priceless.
Agreed.
Yeah, totally priceless. Who should consider neuromuscular therapy combined with a massage? Who do you consider, like people, runners? People who works in office all day, who do you consider to have this treatment?
I will say, and I think you could agree with this, everyone needs a massage. Right?
Oh my God,
Everyone
yes.
needs a massage.
Who doesn't? There is people that they say, I don't like massage. I'm like, why?
Always running around with our families,
Yeah.
everywhere, traffic, commuting, and it just all got busy lives, right? So we can all benefit from a massage. And I think it's most importantly, right, to those people living in chronic pain. And you and I know that there is a lot of people who have lost hope, right?
Yeah.
And it's heartbreaking to see them come into our office, who they have seen multiple providers, get all this feedback about how they've been treated, and go just they're shopping around, have not been able to find that ideal provider who really takes the time to listen to their complaints, to listens to, because oftentimes we know how important the emotional piece is, right? How important, what a role, an important role that plays into their recovery, into their healing. And I think that those we see them coming through our doors, and I believe that the combination, right, and not only right massage therapy or physical therapy, we also have outstanding acupuncturists, right? We have personal trainers, right? So it is our job, right, as providers, to give them the guidance, right?
Absolutely.
To listen to what their needs are and provide them with that resource.
Absolutely. And also, I think even like I have seen patients here, clients, that even though they're going through a chronic pain for years, but the fact that they have found some type of release, they'd be like, Yulli, for 5 days I didn't have pain. I haven't had that in years, Those 5 days are like priceless, because like, wow, you have 5 days with no pain. That's amazing. At least I think with chronic pain and all that, is like coming here, it gives you some answers, but also it maintains you. You might not get 100%, but at least to maintain the pain, especially in elderly people with chronic pains, Yeah.
Oftentimes, you and I see our clients who are in their 80s, right? And they oftentimes share with me, hey, I know we are living longer, but no one has ever looked at our quality of lives, right? I'm not able to sleep. I can barely go to the grocery store. I can barely do my day-to-day tasks. I need to come here. I need to be worked on, because this is what keeps me going.
Absolutely, yeah. There is also a lot of people that they be like, "Oh, I went to the doctor," and they say, "Well, basically, you're aging and you're old. That's why you're in so much pain." But to me, it's like, yes, aging is one thing, but you don't also need to be suffering and with all these pains. I mean, there is a room for like improvement with your chronic pain.
Yeah, and back to your question, I think everyone can definitely benefit from a massage, right? Everyone can benefit from physical therapy, but it's more importantly those who are truly seeking out for a provider that best suits their needs. Their needs, it's key in their recovery.
Absolutely. Yeah, that's why I like to get involved with the community, because strengthening personal trainer, Pilates is so important in this, because the strengthening, that's what I think people are also missing, that's another piece.
And I also, just to add to this conversation, it's also important and very, very rewarding to see people out in the community, for us to pick up on those individuals who truly we know that could benefit from the care that we're providing. And to see the change, right? To see the change in their outcomes, it's outstanding. And can probably say that very fortunate as physical therapists to be able to provide a prognosis to our clients, right? We see a patient on day one, we do a run through the evaluation, we pick up on the impairments, we come up with a hypothesis of what we think is wrong with them. And to be able to tell someone on day one, you're gonna be well, you're gonna get so much
hope,
better from what we're doing, giving that hope. And it truly is just what a rewarding, we're very, very fortunate as providers. We again just need to be very, very careful with having with doing a good job on day one, to give them that hope, give them that
especially if we have people, I'm being a physical therapist and for 2 years and I haven't gotten this care, this treatment, and here I come in one session with Dr. Avila and I'm all better. So if you are looking for this, if you're looking for this type of treatment, and people out there that they haven't have hope, this is the place.
And I can share with you one recent case of a woman who has been living in chronic pain over the last 3 years. She came in on day one and say, Arturo, I was skeptical after my first visit. I didn't think you could help me because I've been in pain for so long. I've seen so many providers. But after your first session, you have changed my life completely.
Oh my God.
Now I believe in physical therapy. I believe in massage therapy. And what you guys do, everybody should know about it.
Absolutely, yes. And that is, I'm telling you, I sleep better when a client gets better here, because that's what we're here to help them. But not only just to actually keep them that way, to keep them healthy, That's our mission. And I think your mission, it goes hand in hand with our mission at the Healing Center.
I agree.
Absolutely.
And I tell, as soon as I see a quick change in someone's symptoms, my first few words are, that is why we're here.
That's why we do what we do. Yeah.
Exactly.
Absolutely. What would you like people to understand about their bodies and the healing process?
I truly would like people to know that even if they've been in pain, even if they have seen many providers, even if they have tried multiple things, that there is always going to be one thing that works for them. One or hopefully multiple things, right? And that thing is, in healthcare, it's not a precisely exact science, right? No one can give you the exact number of days that you will be 100% or the exact percentage of how much you will improve, right? We're estimating. And I think even if they have tried multiple things, I don't, I will still encourage them to continue to seek for other options, because what works, and you and I know this, what works for one person may not work for the other person.
Absolutely.
So I think it's important for everybody to know, everybody living in chronic pain, to just give themselves a chance, another chance, right? To keep searching for what works for them.
Absolutely. Absolutely. Yes. And I will say to our audience, if you are listening to this interview and you've been suffering with chronic pain or any pain, physical pain, we are here to help you. Don't suffer anymore. Come and try us. Come and see how you will improve your wellness. This is a journey. And just remember, when we collaborate, healing is such a beautiful thing, because now you have a team to get you better. And this is the time for you to heal your heart and yourself. This is for men or women. It's a kind of sensitive subject because we don't like to talk about this, but we have an amazing machine here called Encella. It helps to strengthen your pelvic muscles. You come and sit down with clothes on. It's not invasive treatment. In 29 minutes, you can get about 11,000 Kegels that help women when you're playing tennis or pickleball or jumping in a trampoline with your kids and you have accidents, or you just can't wait for the next exit to catch the bathroom. You don't need to suffer. We have this amazing machine. It's been around for a long time. Every client that has used it so far, great results. It really can help you to improve your lifestyle. And I can't wait to see you. Please sign up for a free session. Come and try it. You will thank me later.